Hi, I'm Dr. Blanche Grube. In a previous lecture, we were talking about energy patterns in the body and how having metal in your mouth can affect the amount of electricity in your mouth, and having dead teeth can affect the electricity in your mouth. And all of this electricity can affect the meridians that flow through your body, or the energy patterns that flow through your body. In Western medicine, we're very knowledgeable. As a matter of fact, we're so knowledgeable, we actually have a name for every nerve fiber, every muscle, every teeny little piece of tissue in the body. We have a name for it. In Eastern medicine, they're very familiar with the energy patterns in the body. So there's the heart meridian, the large intestine meridian, the kidney meridian, the gallbladder meridian. And they talk about the energy patterns that flow around through the body. This is all very important if you're going to look at a person and consider them holistically and take into consideration everything in the body. Well, that brings me to my philosophy about dentistry. I'm a firm believer that people shouldn't have a lot of metal placed in their mouth simply because it does affect the meridians. That's easier said than done. There aren't too many products that you can use to restore the mouth that don't have at least a little bit of metal. Even the composites today have a little bit of iron oxide. Your ceramic fillings have aluminum oxide. Your partial dentures, some of them have metal clasps made out of titanium. Very difficult to have a metal-free mouth. But having said that, you would want to try to have, if you're concerned about your health, you would want to try to have as little metal placed in your mouth as possible. In our office, we do primarily composite fillings, composite crowns, and plastic dentures or nylon dentures. This is basically how we restore the mouth. In the future, they're going to be able to come out with some ceramic materials, particularly one called zirconia. It has very little aluminum in it. Matter of fact, the president of the company tells me that zirconia now has 0.004 micrograms of aluminum. That's an incredibly small amount, and that's a good thing. So how does a person decide what dental materials they're going to have in their mouth? What should you put in your mouth? Well, prior to my becoming a biological dentist, I was just like every other dentist in the United States. If there was a composite or a material that was advertised in a magazine and the price was right and the numbers looked good, in other words, the strength looked good, the appearance looked good, the ability to handle this material looked good, I would buy it. And that would be a material I would try out, and if I liked it, I would keep it. And if I really liked it, I would buy it on sale and buy 12 dozen boxes. And if I didn't like it, I would stop using it and I would try something else. And if you were a patient in my office at that time, you would get the material that I was using that week, or maybe that month. There really wasn't anything else that we did to decide what materials was best for a patient's mouth. Then I found out that there is a form of testing done in the United States called Biocompatibility Testing. 2 vials of blood are actually drawn from the patient's arm, and then the blood is spun down so that the serum is separated from the red packed cells. The serum is what is frozen and shipped to the company that does the testing. Then they take the serum and mix it with dental components. Now, in that little test tube, you have serum and dental components. There are antigens within the dental component. What's an antigen? An antigen is something that's not you. In previous lectures, I've told you that white blood cells have one job and one job only, and that is to recognize self from non-self. An antigen is something that is non-self and that the white blood cells know they must plan an attack to get rid of. So when you place an antigen in with the patient's serum, a reaction takes place. The antibodies within the serum will either react to that antigen or not react. If they do react, then you get a clumping They call this protein precipitation. You get a clumping inside the test tube. In fact, it clumps so much that you can't even pass a light through it. It actually turns a chalky, chalky white. And so you know that this is a material that might seriously cause a reaction in the patient's body. If the antigen and antibodies don't react to each other, then the solution stays clear, and a lot of light goes passing through. Well, this is a very scientific way of measuring the amount of light that goes through each sample, and then they can tell you which dental materials you have a reaction to and which dental materials you don't. Well, when I first heard about this, I thought, wow, I never knew you could have this kind of testing done. I never knew that there was a way for a dentist to know ahead of time which is the safest material to place in this patient's mouth. So I was very excited about it. I think everybody who's going to have major dental work done and is trying to decide what should I put in my mouth, should I have metal? Should I not have metal? Should I have plastic? Should I not have plastic? What kind of composite should I put in my mouth? Gosh darn, there's probably 1,000 active composites on the market today. How do you know which ones are best for you? You can have a compatibility test done on your own blood and find out which materials cause a reaction in your blood and which ones don't. I think it's a smart thing to do.